Bah humbug. Bah humbug. Bug humbug. Bah bah bah. Yes, we've got Boris back. Um, I know, you're so excited. I'm excited. I get excited, you get excited too. Um, and he's going to do some blustering. I've deliberately not watched the news, mainly because I've had no internet at the shop all day, and the fact that I've had no internet at the shop all day. So I thought what we'd do is, before he starts blustering and waffling and blustering, if you want to get to that part, then I will put a time when he starts blustering and waffling and blustering and waffling at some point in there. So, I'll give you my thoughts on what I'd do if I was Prime Minister. Oop, COVID. What I'd do is, I would be like, stuff like that. Anyway, let's have a look, see if this is working. It is working. Hello. You finally found the giant what's it's in Tesco. It's a bit too serious, that, for what we're talking about. God, you just can't get the people, can you? Anyway, what I would do if I was Prime Minister. Number one, I'd tell the Europeans to stick it up the posterior. Brexit, we're leaving, and we know they're not going to give us a good deal, because if they do, then their countries will leave. So we'll just get a deal, and then we'll just deal with everyone else. Sorted. Then we get on to COVID, and the biggest, I mentioned this yesterday, the biggest rule breakers I found are people whom are shopping in supermarkets. They are by far and away the biggest rule breakers. So all we need to do is shut the supermarkets. That's not a joke, genuinely. Shut the supermarkets. If the supermarkets can't be bothered to stop people coming in with no masks on, and people, when they're in there, don't understand what social distancing is, then we shouldn't have them. Pubs, yeah, I'd shut them down completely. Everywhere, just gone for the time being. And restaurants, I'd keep restaurants open, but I'd only keep them open, and they could sell drinks, but they could sell only a maximum of 2 drinks per person. And children do not count as a person. So don't try and think you can bring 3 kids in with yourself and have 8 drinks. Don't work like that. Anyway, Boris is about to start. To show you what I'm looking at, I'm looking at that, which is directly from the live stream of 10 Downing Street. I'd also shut places like tattoo parlours, anything where you get really up close and personal. The places do eyebrows, all that kind of gubbins, and barbers maybe as well. And the economy, everyone's going, oh, the economy's terrible. Well, the whole world's economy's terrible. What we need to do is sort this out first, and then worry about the economy afterwards. Again, we've got a double whammy with the economy, because we've got Brexit and we've got COVID. So, you know, what can you do? So we're just waiting now for Boris waffle waffle, Boris waffle waffle waffle, and just see what he says. Just check it. Just check if we've got not got any dandruff. Yeah, we're all right. I do use Head and Shoulders. Only a few people get that. It's quite funny though. So yeah, we've got about 5 minutes before this starts. So yeah, as I was saying before, supermarkets, biggest breakers. I would fine shops. I own a shop. I would find shops who let people in who don't wear masks, who should wear masks. If you can't wear a mask because you've got a medical condition to do with breathing, why are you outside when there's a pandemic of something that could kill you if you catch it, and you've not got any protection because you won't wear a mask? It makes no sense. So yeah. Online shopping, yeah, I think if you shut all the supermarkets, then everyone would be online, and that'd be fine. Or just go pick up and collect, click and collect. So you just go and pick up outside, and they just bring your stuff to you. We can get around it. Yeah, but a lot of them are good, but a lot of them are not good. That's the problem. Anyway, Boris is a bigger man than me. Don't get me started on terrorists. So we're going to... yeah, I don't get it. It's like I do a lot of reviews on vegetarian food that looks like meat. And you're like, why, if you're a vegetarian, when you want to eat something that looks like meat? Surely the whole point is you're opposed to meat completely. Therefore, you won't want to eat it, so eat something that looks like meat. And let's be honest, it doesn't really taste like meat or whatever. Although bacon's getting better, I'll be honest with that as well. Hi, John. So, welcome to this weird channel. We've got the stream directly from 10 Downing Street, which is there. And we'll be commenting on it as and when it occurs. I've deliberately not listened to the news or watched the news or anything, because I know he said some stuff with his dandruff, with his blue suit on, in the House of Commons, but I've no idea what he said. We've got about the 3T thing for a long while, so we'll wait and see what that's about. Oh, I had a flash then. The whole screen flashed. Ah, he'll save every one of us. So, we're doing a bit on... average watch time is 1 minute and 39 seconds. Got an excellent connection. Got 20 playbacks already. So yeah, it's all going well. Last time I did this, I had to watch it on replay with what's he called? Oh, I forgot what it's called. I did see something about the student getting fined 10,000. I'm watching it on Xbox on YouTube. Did I buffer then? I don't know. Let's get rid of that anyway because it's annoying. So I'm watching it on YouTube on Xbox in Blowthorpe. Oh, Bowthorpe. Sorry. Oh, we had a Freudian slip in the shop today as well. Someone said something that was highly amusing, which I can't repeat in here. It was very, very funny. Anyway, this isn't funny. This is serious stuff. We are talking possibly... Oh, wrong one. Most important thing that's happened in Britain since the last important thing that happened in Britain. Who am I trying to kid? Anyway, you're appearing online so I can see it. Well, yeah, this is on YouTube. I'm actually live at the at 10 Downing Street at the moment. I think I can get away with that with my old school tie on. Actually, it's a Dixon's tie. I used to work at Dixon's, but he always wears a red tie, which is weird because he's a bluey. So. Yeah, we're just waiting for it now. It should be any minute now, actually. I've told you what I'd do if I was Prime Minister. Which is close the supermarkets, because that's where I think most of the stuff's coming on. Keep restaurants open, but they can only serve 2 drinks per adult. Close all the pubs for at least 2 weeks. And also the places that do the face stuff, the beauty and all that kind of stuff. And let's be honest, our economy is knackered until the Europeans that we're leaving. We've already left, actually, to be fair. So if they don't give us a deal, we won't buy their wine off them, their German cars off them, their cheese off them, or anything else for that matter. So it's up to them. It'd be full of waffle. I am full of waffle. That's what I do. I'm full of waffle. How are we doing anyway? No, it's still not there yet. I don't know why I did that, because I know it's not there, because I've got 2 screens. Duh. So, he's on TV now. Oh, he's on TV now, is he? Well, we're doing it live here. We're not doing it live there. Can't be yet. It's not 7 o'clock yet. Waffle, 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 waffle. Waffle, stuffle, stuffle, waffle. There we go. Waffle, 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 waffle. TV. Channels. 1. That'll do. Oh, it's... Shut up. I don't want to talk about 3 tiers. Oh. What's happened? Oh. I didn't realise they were playing music. I just thought it was a thing. Let's play music. Anyway, the BBC's waffling inanely. I've only got myself to talk to. Or you. 6:59. The question is, has he had his lint roll on his shoulders? Changed his jacket. So yeah, if you just joined us, I've told you what I'd do if I was Prime Minister. Shut the supermarkets, keep the restaurants open, shut the pubs, tattoos and face parlours and things like that, get rid of them. Anything that's really close contact and anything where a lot of alcohol is involved. Restaurants can stay open as long as they only sell 2 drinks per adult, and supermarkets, I think, are where the big spreaders are. Because how often have we all been in supermarkets when people blatantly haven't got a face mask on when they should have a face mask on? And my argument also is, if you can't wear a face mask for health reasons, I get the anxiety, but if it's health reasons, what are you doing outside when there's a pandemic on where your breathing issues could potentially kill you, because if you catch this, you're dead. Oh, here we go. Sorry, got far too excited. I need to change channel as well so I can hear what's being said. Waffle.
Good evening, everyone. Thank you for joining us. I'm glad that we have the Chancellor Rishi Sunak with us and our Chief Medical Officer Chris Whitty. We're entering a new and crucial phase in a fight against coronavirus, because the number of cases has gone up 4 times in 4 weeks, and it's once again spreading among the elderly and vulnerable. There are already more COVID patients in UK hospitals today than there were on the 23rd of March when the whole country went into lockdown, and deaths, alas, are also rising once again. These figures are flashing at us like dashboard warnings in a passenger jet, and we must...
I have a car, I don't have a passenger jet, but carry on.
So we're giving local authorities across England around £1 billion so they can protect vital services as they fight the virus. Nightingale hospitals across the north of England are being prepared for service. And so we can squash this virus wherever it appears, we are today simplifying, standardising, and in some places toughening local rules in England by introducing 3 levels of COVID.
That makes sense.
Medium, with existing national measures such as the rule of 6 and the closure of hospitality at 10 p.m. High, with extra measures including a ban on indoor social mixing between households or support bubbles. And very high for places where without further action the NHS will swiftly be under intolerable pressure. Areas within the very high alert category will be reviewed every 4 weeks, and nowhere will be shut down indefinitely. And the exact restrictions at this level, very high, will be worked out with local leaders along with tailored packages of
So it's not
support.
standard then? Well, we're doing a standard thing here, but
Minimum,
it's not standard because we're going to talk to other people about it
a ban on all
in their
social
areas.
mixing between households in private places, including gardens, and pubs and bars must close unless they can operate solely as a restaurant serving alcohol only as part of a main meal. We will also ask people not to travel into and out of very high alert level areas. No one affected by this will be left to fend for themselves, and we're going to expand our unprecedented economic support to assist those affected by these decisions, extending our job support scheme to cover 2/3 of the wages of those in any business that is required to close, and providing those businesses with a cash grant of up to £3,000 a month instead of £1,500 every 3 weeks, and extra funding too for those in the very high category for local test and trace and enforcement.
Okay.
You will shortly be able to type in your postcode to gov.uk and see exactly what restrictions apply where you live. The majority of the country will, for now, be at medium. Most areas currently under local intervention will be at high, and Nottinghamshire, including Nottingham itself, East and West Cheshire, and a small area of High Peak will also move to this level.
Right.
Over the weekend, we've been working with local leaders in areas where the data are most worrying, and from Wednesday, local authorities in the Liverpool City region will move to the very high alert level. In addition to pubs and bars, we've agreed with Liverpool City Mayor Steve Rotherham that gyms, leisure centres, betting shops, adult gaming centres and casinos will close. We're still working with other local leaders to determine how best to tackle the resurgence of the virus in their areas, but tackle it we will.
Up the desk, we must.
No one wants to impose these kinds of, least of all me, wants to impose these kinds of restrictions, erosions of our personal liberty. But I'm as convinced as I've ever been that the British people have the resolve to beat this virus, and that together we will do just that. With that, I'm going to hand over
See,
to
now,
the
I would have gone
Chancellor
for a
some more
2-week
details
total
on
lockdown.
how we'll be supporting these businesses,
The last week of October, the
employees,
first week of November,
areas
and
affected
then
by today's
see how we get on,
changes.
get Christmas out of the way, because that's the economy
Thanks,
needs it the
Good
most,
evening.
and then go
the
from
Prime
there.
Minister has set out the next stage in our
I like this guy.
response to tackling coronavirus. And I know people are frustrated at the prospect of further
I
restrictions.
don't know where he's looking, but
I
anyway.
want to reassure you that we have a
We're over here.
comprehensive plan to protect
Well,
jobs
down there.
and businesses in every region and nation of the United Kingdom. Our winter economy plan has three
Look at their own
parts.
camera.
First, the job support scheme will protect jobs, whether your business
I like the way
is open
it's the job
or
support
closed.
scheme's been
If your business can
improved
open safely,
to 60%, where
but will
currently it was
produce or
80%.
uncertain
So how does that work?
the government will directly subsidise people's wages over the winter, giving businesses the option to bring people back to work on shorter hours rather than making them redundant. That's the right approach for businesses who can remain open. But businesses who are being asked to close will need further support. So on Friday, I announced that we're expanding the job support scheme. If the closures mean you are unable to work for 1 week or more, your employer will still be able to pay you 2/3 of your normal salary, and the UK government will cover the cost. This national programme will benefit people the same wherever they live and whatever job they
It's
do.
not North and South divide.
The existing furlough scheme continues throughout October, with the new job support scheme available from November, so there is no gap in support. And to give people and businesses certainty, the scheme will run for 6 months through to next spring. The job support scheme is in line with most other major European countries. And to support the lowest paid through this crisis, we have also made our welfare system more generous and more responsive too. Second, businesses in England who are legally required to close can now claim a cash grant of up to £3,000 per month, depending on the value of their business premises. Those grants can be used for any business costs and will never need to be repaid.
That's good.
And I'm guaranteeing an extra £1.3 billion of funding to the Scottish, Welsh and Northern Ireland administrations if they choose to do something similar. Third, the Prime Minister has announced today we are providing additional funding for local authorities. For local authorities entering Level 3, we're providing up to £500 million to fund activities like enforcement, compliance and contact tracing.
Yeah, get this.
And to protect vital
Get the army on the
services,
streets.
we're providing around £1 billion of additional funding for all local authorities on top of the £3.7 billion we've already provided since March. Our winter economy plan will give people and businesses flexibility and certainty over the coming months, whether they are open or required to close. All part of our plan to protect the jobs and livelihoods of the British people. Thank you.
Thanks very much, Rishi. Chris.
Thanks, Ben. Could I have the first slide, please?
Oh, slides.
The
I love a
slide
slide.
that follow tell a
Oh.
story that is relatively...
It's a half pipe, but it's broke.
This is the first slide is from the Office for National Statistics, ONS, Household Infection Survey, and it's, in our view, the most robust study of the virus. And what it shows is the prevalence, how many people had it in the population from the end of April through to the beginning of October. And as you can see on this graph, the numbers of people with it went down really steadily through till the beginning of June, thanks to the remarkable efforts of the entire nation, and then continued down at a low level until the beginning of September, at which point they began to rise again. And you can see on this graph that they're now really up to a level that was there at the beginning of May. Next slide, please.
What's the face about?
Can you go back one slide, please?
There we go.
If we look at the geographical spread of COVID
Right.
in the UK in England, sorry, at this point in time, on the left here we have a map which shows the current prevalence, how many people have got it, and you can see the darker colours, which is where the most transmission is occurring, are very clear on the map.
Yeah, darkest is very clear.
On the left.
You get that.
And on the right, what we have is a map which shows the rate of change of this, and the darker colours show the more rapid change.
Just move myself.
And you can see on this map that this is now extending considerably beyond
I don't want to get in the way, do I?
areas in the northwest,
Heaven forbid.
northeast, and parts of the Midlands. So there is already clear evidence of spread around the country, but at this point in time, heavily centred on the areas of intervention. Next slide, please.
Go up.
One slide back, please.
Someone's got a trigger
the
finger.
geographical spread in people over the age of 60 is, however, really important. And this is what this map shows. It's the same as the last one, except as you can see, the area is much more concentrated because you start off with transmission in younger people and then it moves up the age bands. But the reason that this is very important, and I'll show this really clearly on the last slide of this pack, is that the rate in people over 60 is a very good predictor in a bad way for the rates of people going into hospital. Next slide.
Because it always takes 2 weeks from an
We then
infection
use
to end
the
up in
ONS
hospital, and then
data
roughly
in
2 weeks
the,
after that to end up in
different regions of the
ICU,
country.
and
You
2
can
weeks after
see
that
the
or
rates
less to
since,
die.
The middle of
So-
August have been going up steadily in the northeast, the northwest, and parts of Yorkshire and the Humber. Next slide, please. At a more moderate rate in the East and West Midlands and in London. Next slide, please. And at a much lower rate currently, but I think we should be not lulled into a false sense of security here, in the southwest, the east of England, and the southeast. Next slide, please.
Whoa, that's pretty.
And I think something which has got a lot of attraction over the last few days in the press is the fact that there are very variable rates by different age groups. And in blue, light blue, we have those 10 to 19. In reality, this is mainly people over the age of 16, and in green, those 20 to 29. And
So young
what
people
we
have got
have
it
in these
first,
areas
which we
is the
knew
first
anyway.
rapid
to be honest.
rise is in younger people, but
So
then you
that was
start
no-
to see
that was no
rises
surprise.
across the entire age group, and illustrated this in the northeast, northwest, and Yorkshire and the Humber. But the same pattern is being seen at a much lower rate elsewhere in the country.
My age group's going up.
Next slide, please. Now, I think there was a hope that this would not translate into hospital admissions, but the hospital admissions occur at the high end of the age range. And what we have here is everybody admitted to hospital with COVID since the middle of July. And again, initially, a steady fall due to the work that everyone had put in. But on the right, a rise which is on
This
every
isn't
age
bubbling.
band, but in particular in those aged over 65, over 75, and in particular those over 85. And what this is translating into is an increase in hospitalisation, in particular in those areas where there is a high transmission. So this is not just rates going up, this is rates going into hospital are going up. Next slide, please. So the final slide is just to show that, regrettably, when you start to see a rise in the rates going into hospital in people over the age of 60, that is mirrored almost exactly, with some delay, with rates going into hospital, and those curves follow one another inexorably. So watching those rates of people over 60 rising in the community will translate into cases in hospital. My final point is a more optimistic one.
Oh, there's some optimism.
If we had not been doing all the things that everybody is currently doing, if there had not been in every business a real attempt to try and be COVID secure and to limit the amounts of transmission, if people were not seeing fewer numbers of people, which is clearly happening across society, the rates that we're seeing in these graphs would be substantially higher, in my view, and certainly, I think in general, most people's view, significantly higher across the whole country. So what people are doing now are significantly reducing the rates compared to where they would have been, but what we can see is that we need to go further, or these rates will continue inexorably to rise. Thank you very much.
Thanks very much, Chris. Very, very clear indeed. And let's go first of all to questions from the public. Helen from Derby is on the video.
Following your announcement that businesses who need to close during localised lockdowns will receive targeted furlough support for their employees, what support is there for industries like the event sector who, due to government restrictions, have been shut down since March?
Well, I should say that all businesses that have been forced to close get the job support system that Rishi has.
The JSS. JSS. You want to say GSS?
Like the event sector. I mean, you're right, Helen. It's a massive business. I think it's worth about 90 billion to our country. But there's plenty that we're doing to support it.
Yeah. Thanks, PM, and thanks, Helen. You're absolutely right. We've put support in place since March for across hospitality, leisure and retail through our business rates reduction program, so people with physical properties are not paying any business rates. Many businesses would have received cash grants of £10,000 or £25,000 at that time. But you're right, there are some sectors which are now not able to trade in the way that they normally would. And for those, what we've put in place is the job support scheme, which allows companies who are open but not trading to benefit from wage support from the government. So they can bring employees back, but not at the same level that they previously had, because the demand is not quite there, the activity is not quite there, and that wage subsidy will help. And that's something we announced a few weeks ago. I think more broadly, there are specific businesses that are being told to close by government, not just now, going forward in this localised way, that have been told to close for a while. Now, if you're in that category, nightclubs being another one, for example, you will be able to benefit from the expansion of the JSS if you've been told to close.
See, one big thing I have is I don't think you can catch this outside.
Business grants. But I'm very
so all the indoor events, I get it, but like outside events, I don't get.
We're all keen to try and find a way where we can to get our economy going and get your businesses back to life as well. That's the best way in the long term to try and protect the jobs that your sector has.
Brilliant, thanks, Rishi. Let's go to Charlotte from Chesterfield. Charlotte asks, after months apart from our extended families, many people are clinging to hope of having some kind of family Christmas, though understandably not a normal one.
It is normal. It's the new normal.
Expect over the festive period, Charlotte asks. Well, all I can say, Charlotte, and to millions who are wondering the same question, is that we'll do our absolute best to try to make sure that we get life back to as close to normal as possible for Christmas. But that is going to depend, I'm afraid, on our success in getting this virus down and our ability as a country to follow through on the package of measures. And I've said it before and I've said it again, but it will mean that in those local areas that we've talked about, we're not only going to have to intensify the measures, but we're going to have to enforce generally the social distancing, the rules, the guidance, hands, face, space, get a test if you have symptoms, self-isolate if you're contacted by NHS test and trace. All that basic stuff is essential if we're going to come out of this and allow people to have anything like a normal Christmas. But Chris, is there anything you want to add on that? Thanks very much.
No, don't get me involved with Christmas. I don't want to say anything about Christmas. No.
And first to Laura.
Oh, my Laura. I mean, sorry.
Thank you very much, Prime Minister. A question for each of you tonight. Prime Minister, you've said many times you want to avoid another national lockdown, but it seems every week you introduce extra rules and cases still rise. Are you just delaying the inevitable? And Chancellor, you encouraged people to go out and spend money when cases were much higher still in the north of England than in the south. How do you now expect workers in pubs and bars in the north of England that have to close to live on 2/3 of their wages when they can't pay 2/3 of their bills? And Professor Whitty, are you confident what's being announced now is really enough to slow the spread of the disease? Can I just lastly ask one of you to explain what people who are really vulnerable, who may have been shielding, should do now, because we haven't heard very much about them today.
That's four questions.
First of all, Laura,
get some money's worth.
I really hope that we won't have to go back into anything like a national lockdown of the kind that we did in March and April. And I really hope that with the package of measures that we've got, if properly implemented and enforced, we can get the R down. And I just go back to what Chris was saying. These measures do work. I mean, don't forget the R was coming down in this country before we went into full lockdown in March, because people had already started to follow guidance about restricting contact and restricting transmission in the way that they needed to do. Lockdown was also essential to drive that home. But this package depends on public support. I think what's encouraging today is we've got people like Steve Rotherham in the Liverpool City region stepping up with strong local leadership. I think if we can get that over the next few days across the country in the areas where we've got high incidence, that will make a huge difference. But be in no doubt, this is a balanced package. We could go for a national lockdown again. I think many people would think that was extreme, and it would do a great deal of extra harm to our economy, to our ability to. We'd have to take kids out of school. It would do a lot of immediate harm. We don't want to go down that extreme route right now. Similarly, there are the people on the other side of the argument who say, "Oh well, let's just learn to live with this. Let's stop trying to fight this virus. Let's stop trying any kind of measures at all to contain it." I can't support that approach, I'm afraid, Laura, because it would, all the maths is brutal. It would lead to too many fatalities. So we have to do a balanced approach.
Yeah, you're damned if you do and damned if you don't, to be fair.
Approach that we're taking.
And at the end of the day, I'd sooner have bumbling Boris than Cretin Corbyn.
Government at all levels to make it work. Yes.
Laura, you're absolutely right. This is very difficult for people who aren't able to be at work, and that's why throughout this, I think all of us have had that in our heads, and we've tried to protect as many people's jobs and incomes as possible, and that remains at the forefront of our mind as we go through this difficult winter period. With regard to the exact level of support, I'd make 2 points, if I may. The first is that at 2/3, we're very much in line with large other European economies who provide similar wage support schemes. France, for example,
we were best in Europe last time. Now we're
70%
similar to
depending on
them.
the sector. Germany's scheme starts at 60% and goes up from there. Spain at 70% and drops down to 50%. I could go on, but you'll get the broad picture is we're very much in line with peers. But obviously that might not be comforting to you if you're the person on the other end of that and you still need to try and make ends meet. What I'd say is we've invested several £billion in improving the generosity of our welfare system this year, primarily through the increase in universal credit and also local housing allowance. And what that means is not only is that system more generous, it's also responsive to people's needs. So as people who are the lowest paid that you talked about see that their earnings are going down, the way universal credit works is that the welfare payments will go up to compensate for a good chunk of that. And if you look at someone, say in their, pick an example, someone in their late 20s, privately renting, working 35 hours at the minimum wage, let's just say living in a city like Manchester, for example,
Northern.
they would see on an after-tax
Told you like this guy.
benefits change in their income would mean that they're probably just over 90% of their previous income once all those changes.
And if you don't go to work, you don't buy lunch at work prices, you don't pay for transport, parking or anything like that, so that comes off as well.
the two you asked me, I am very confident that the measures that are currently in place are helping to slow the virus, and these measures will help.
To be fair, every time I see this guy, I always think he doesn't look well, which is ironic.
Confident that the Tier 3 proposals for the highest rates, if we did the absolute base case and nothing more, would be enough to get on top of it. And that is why there's a lot of flexibility in the Tier 3 level for local authorities, guided by the directors of public health, who are absolutely superb around the country, to actually go up that range, so that they can do significantly more than the absolute.
I don't understand how we have 3 tiers where the top tier is different in each place. That's exactly what we've got now. So it's pointless.
That could be done within that.
If it said, right, you're in tier 1, then okay, then you can't do this. You're in tier 2, okay, we can't do that. You're in tier 3, okay, they have to shut. Simple, done. None of this. Well, we negotiate, and you know, some places the pubs will be open, and some places they won't. Some places shops will be shut. It makes no sense.
Everybody doing their bit within this, and therefore that is important, that we have local as well as national agreement. This is what we need to do. In terms of your fourth question on shielding, Jenny Harries is going to give a much longer, I think, discussion on this tomorrow. But the short version is people who were previously in the shielding group are at greater risk. We would advise them always to take greater precautions, but we also recognise that there was significant difficulties and often mental distress and loneliness for people who were put into shielding, as they certainly perceived it. And I think we're trying to deal with that in the way that we approach shielding over the next phase. But it is something where we do want people to take extra precautions where they can.
Thanks very much, Laura. Let's go to Robert Peston of ITV.
No, it's just Laura asked all my questions.
Prime Minister,
oh, here we go.
Are you saying that if it were not for the opposition of some mayors and local government leaders, other areas, especially in the north, would already be in the very high category? And Professor Whitty, the Prime Minister, said today that there are now more people in hospital than when the country was locked down on March the 23rd. People are scared and confused. We know that lockdown suppressed the virus. How can we be confident that these much lesser measures will do the same job of protecting us?
Well, first, Robert, it's absolutely correct to say that we're working with local authorities across the country, but particularly with those badly affected regions that everybody knows about in the northwest, in the northeast, Yorkshire, Humber, and so on, trying to work with them to support a collective package of measures. I was very pleased that Steve Rotherham of the Liverpool City region came forward.
These two need to get a room, don't they? Steve Rotherham and Boris.
Him and the offer is that to all local leaders who are facing problems, big increases in infection rates, will help to support more local test and trace, more local enforcement, and so on. Where we stand ready to work with local government at all levels. But clearly we also have, as a national government, we have to think about our primary duty, which is to save life and to protect the NHS, and we will also do whatever we think is
saves life, protects
over the next few days.
Citizens, uphold the law.
My experience as a doctor has been absolutely that people in Britain actually do not tend to get scared. What they want is people to give them very straight news and know the worst, and then discuss what we should do, and then get on and work out a plan for how to do it. Now, in terms of lockdown, as people put it, I mean, lockdown now means a whole bunch of different things in different areas, and we're not talking about the kinds of lockdown there were at the end of March and the beginning of April. But it is the case we are going to have to do more. That's the whole point of what the Prime Minister has just announced, and probably in some areas significantly more. And the balancing act here, and in a sense that's reflected by the fact the Chancellor and I are standing here, is doing things which do the things which pull down the virus to the point where the R goes below 1, but with a minimal impact on the economy that you can get away with that. But none of us have any illusions about this, and I would like to be really clear about this, because I think we should not have any illusions. The idea we can do this without causing harm is an illusion. And every country in the world is struggling.
Yeah, I've already said that.
And I'm confident we will get through it, but it is a balancing act between two harms: a harm for society and the economy on the one hand, and a harm for health on the other hand. And if we damage the economy, we damage long-term health, and if we damage health, we damage the economy and the confidence in the economy. So getting these right is critical, and we're all trying to find the balance, the middle way, really narrow path between these two harms on either side. Accepting whatever we do is not going to be easy.
Thanks very much, Robert. Beth Rigby of Sky News.
Oh, Beth.
Thank you, Prime Minister. You just said the latest data is flashing at us like dashboard warnings in a passenger jet, and we must act now. And yet the only part of the country
Get your hair out your mouth.
put under these much stricter rules is the Liverpool
Thank
City region. Why is your rhetoric on this outstripping the reality of the measures you're actually introducing? And is it because you're struggling to take regional leaders with you? And Chris Whitty, some areas like Bradford, where I am now, have been living under restrictions throughout the summer and into the autumn. An analysis from the Labour Party.
Oh, she's in a hotel.
19 out of 20 of those.
I wonder what that light was above the door.
Lockdowns have still not come out of them. What is going on? Were they the wrong restrictions, or are people not following?
People not following the rules.
Well,
Simple.
First of all, Beth, I mean, just really to repeat what I said to Robert, we want to take local authorities with us. That obviously a local approach can be immensely valuable in enforcement. There's the local knowledge of the area, the places, where the virus may be transmitted. Local activity in closing down people who are transparently breaking the rules. Local enforcement, local test and trace. These can be fantastically powerful, and we want to work with local authorities to deliver this, and that's why we're offering the deals and the solutions that we are. But just to repeat the point I made just now, if we can't get agreement, then clearly it is the duty of national government to take the necessary action to protect the public and to protect public health, and we will.
And on Bradford specifically, Bradford actually has shown superb leadership. The local authority has, the directors of public health have, the local NHS have, in the way that they have tackled this. If they had not done so, and consistently working with the communities of Bradford, we would be in a substantially worse place than we are at the moment. In terms of what Bradford is trying to do, as every town and city and area of the country is trying to do, is to find this balance between keeping the rates down without doing unnecessary harm to society, to the economy, and to all the other things that in the long run have major implications. And I think they've done a large number of very imaginative things. Yeah. I see no evidence that this is because the people of Bradford are flouting the rules. I think inevitably, very occasionally people will, but the evidence over the country as a whole is the great majority of people intend to follow the rules and do.
Just tell us what the rules are. We can follow them. None of this. You can't do that, but you can do that if you live over the other side of the street and you've got a different postcode. That makes no sense.
Once we get through the winter, which is going to be difficult, and everybody knows that.
Thanks very, very much, Beth. Let's go to Gordon Rayner of the Telegraph, Daily Telegraph.
Thank you, Prime Minister. You pointed out earlier today that there still isn't a vaccine for SARS.
What the hell's he at?
If there isn't a COVID vaccine this winter, will your default position be to ask people to adhere to the current restrictions for the coming year or so? And just also, Andy Street, the West Midlands Mayor, has pointed out that his area is in Tier 2, even though it only has a quarter the level of infection that Manchester does, which is in the same tier. Do you acknowledge that there are huge inconsistencies in the decisions over which area goes into which tier?
Well, Gordon, first of all, on the sort of variations in the tiers and people's feelings of there are anomalies, that's inevitably going to happen in a complex campaign against a pandemic like this. I don't want to put the West Midlands, I don't want to put anywhere into the measures that we have to do, but as you've heard from Chris, we have to, and as you've heard from me, we have to get that virus down. It is necessary. I mean, I'm afraid it is going up in the West Midlands, and as indeed it is across the whole country. There's no area where it isn't going up anymore, alas, and that's why we've got to take especially dynamic measures in those areas that are particularly badly affected. And on your bigger point about what happens if there's no vaccine, well, that doesn't mean that there's not going to be the kind of scientific and technological progress that will start to make a real difference.
Hi, BJ.
You're seeing how drugs are changing for the better. The mortality rates in ICU, drugs, the treatments and understanding of the disease is helping to reduce the number of people who go from a hospital admission into ICU. We're making progress in fighting this disease, and we will continue.
Of course you do.
To make.
I don't know you're managing to type on here when you're on the telly live.
I have high hopes, as I said.
Just shows how clever you are.
We will get much further on types of mass testing. But for now, I'll hand over to Chris to give a longer term prognosis. But for now, this is the best utensil that we have to fight the virus collectively together. Strong local and national measures combined.
I mean, I'm just going to reiterate really even more strongly what the Prime Minister has said. We collectively, humanity, has a phenomenal capacity to tackle infectious diseases. Sometimes by vaccine, sometimes by drugs, sometimes by other measures. But our track record on this collectively has been remarkable, and the UK has been one of the leaders in this, and the UK is one of the leaders in a lot of the science that is going on at the moment. So this does not depend on a vaccine. Science will support us from many different directions, and I cannot predict, and no one can predict, what are the combinations of treatments, vaccines, diagnostics and other interventions that we will have available to us. But I am extremely confident that when we go into the next winter, we will do so in a remarkably better place than we do today.
Thanks very much, Chris. Thanks very much, Gordon. Helen Pitt of The Guardian.
Guardian. Come on, Ellen.
A question for the Prime Minister. The Deputy Chief Medical Officer, Jonathan Van Tam, said earlier, the epidemic this time has clearly picked up pace in the north of England, earlier than it did in the first wave, and that almost certainly relates to the fact that disease levels in the north, and certainly in the northwest, never dropped as far in the summer as they did in the south. Do you accept then that lockdown was too early for the north of England and was a decision taken from London to suit London and the south? And a question for Chris Whitty, what evidence is there that hospitality is the key setting for infections?
No, Helen, I don't accept that at all. And I think the difference between
I don't understand a word of that
bout of the pandemic and the first one is how much more localized it is. And we took measures on a national basis then at every stage and on the basis of the scientific advice. That's what we did.
On the evidence on hospitality, so I think Jonathan Van Tam, to go back to your first bit of your question, put it extremely well today. What we have is a group of things all of which contribute to people mixing, and the ones that are the most likely to lead to transmission events are indoors, with households that are not your household, in relatively crowded environments in certain places without masks and so on. This is true for hospitality, it's true for other sectors as well, but it is one of the areas where around the world there is a view that this is one of the contributors, not the only one of the contributors to this. And that is the reason why the hospitality sector has been involved in restrictions, in some cases very significant restrictions, in multiple countries across Europe and the rest of the world. This is a professional judgment. We will not have randomized control evidence or grade A evidence of that sort for some time for any intervention. Currently we have basically two poles that we are confident of. A full lockdown works, and letting it go will lead to very substantial numbers. Between those, what we're trying to do, and every country is trying to do, is find for any particular society, and for our society here, the right balance between the various things, all of which cause harm, all of which we would not want to do, but which can collectively, if you do them all together, pull the numbers down. And if you look at what the UK has decided to do, and for good reasons, in terms of protecting education in particular, but other things as well, then you
that explains a lot, Boris.
So that is the situation we have with hospitality.
And don't forget, Helen, we're not an outlier in this, in the sense that I think they've closed the bars in Paris, and in Berlin they've got the first curfew since 1949. So there's across Europe and elsewhere you can see people tackling this in very similar ways. Let's go lastly to Liam Thorpe of the Liverpool.
Oh, Echo. Liverpool! Wait, this will be good. You're right, La.
Initially, to the Chancellor, back in the spring, you deemed it appropriate to pay 80% of the wages of no longer work because of the lockdown. Are you now saying that the jobs, the lives, the prospects of the hundreds of thousands of people in the Liverpool City region, many of whom will now earn less than the minimum wage and be unable to pay their bills, some of them may even be forced into destitution, are they valued less now? And to the Prime Minister, you've tried to strike a sort of chord of agreement and cooperation with the leaders of the Liverpool City region. We're getting a very different idea locally. The first that anybody here, including the leaders, even heard about your plans to shut pubs, etc., was in the pages of the national newspapers. And today, at the very last minute, Matt Hancock called a meeting with the region's MPs with 10 minutes warning, meaning that several of them missed the briefing, some of them trying to connect on a train. They've described it as just a total lack of respect for a region where you potentially won't win any votes. Is it that, or is it just the chaos of trying to organise a lockdown?
Well, Rishi, you want to go first?
Liam, I think it's wrong to say that any particular area has been treated any differently to any other. We value all jobs and all people's livelihoods equally. The schemes that we've put in place are national. So wherever you happen to be, wherever you live, whatever job you have, that's not just regions in England, but wherever you are in the United Kingdom.
Is it bad that my green screen's better than their green screen?
Scheme. So if your business happens to be told to close and you work for that business, wherever it is, you will be treated the same. There's no difference in Liverpool or elsewhere as we go through the winter. I think that's the first thing to say. I think secondly, in terms of the level of support, obviously you heard my answer previously about our levels of support being in line with most other major countries, and indeed for those on the lowest page, you talked about those on the minimum wage. It's precisely those people who benefit the most from the responsiveness of our universal credit system, and the example I gave you, it would show that actually someone in that situation will end up on over 90% of their post-tax, post-benefits income after this situation. So I think actually that shows that the system is working. More broadly, we are in a different phase of this now. What in March we thought you remember the original furlough scheme was meant to last for 3 months and obviously has ended up going on for 8 months. Now we're putting in place support that we believe is both sustainable and affordable for the long term. The scheme, the job support scheme.
To be fair, there's no point giving people 80% of a wage of a job that doesn't exist anymore, is there?
And individuals with that degree
Sadly.
of certainty and flexibility to manage through the period, and that's a level of support which I think in absolute terms will protect a lot of people's incomes and livelihoods, but is also sustainable over the
I bet he got some ribbing when he was at school, Matt.
Thanks. And Liam, just on your point about cooperation with the Liverpool City region, actually I talked to Steve Rotherham yesterday about what we were doing, and he was at the Cobra meeting today to greenlight the proposals. And my team's been talking to local government across the country for days and days and days, and we will continue to do so, because I do think that the package of measures, if we implement them all, as Chris has said, very effectively, if we implement Tier 3 properly in the way that it needs to be done, I do believe that we can drive the R down in the way that we need to do. But it will take a combination of local and national government working together to get this done. And of course, it will also take all of us to play our part and do our bit and follow the guidance. Thanks very much, Liam. Thanks you all very much, and see you next time.
Oh. So there you go then. I'll take his place now. Yeah, bluster, bluster, waffle, 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 bluster, bluster, waffle, 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 bluster, waffle, waffle, bluster, waffle, waffle. So, right, so tier 1 is basically rule of 6, not going to pubs, and other stuff. Tier 2 is, I forgot already, but tier 3 is shut the pubs, shut the restaurants, shut this, that and the other, and go to the local people and ask them what they want, so it's different in every area. Surely the whole point is for tier 1 to be A, tier 2 to be B, and tier 3 to be C. So if you get told your town or city where you live is in tier A, B or C, or 1, 2 or 3, or whatever you want to call it, you know exactly what it means. Not you're in tier 3, which means in your area something different than what it does in Liverpool, or something different than what it does in Nottingham or Manchester or Yorkshire. It's got to be the same for all of us, and I don't understand why they don't get that. Bluster, bluster, waffle, 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 bluster, bluster. But I definitely shut the supermarkets because that's where people are breaking the rules. I definitely fine shops and other establishments for letting people in who don't wear a mask, or at least not challenging people, because I see that all the time, including at the big supermarkets. I'd also shut all the pubs, full stop, shut them. I would also put restaurants where they could open, but they could only serve 2 alcoholic beverages per adult customer. I would tell Europe to stick their trade agreement up their posterior, and yeah, I think that pretty much solve all the problems we've got. Is there anything else I said? No, that'll do. So there you go. That's my thing for being Prime Minister. So, thank you very much for watching. Don't forget to like if you enjoyed this. Personally, I think that went well. To be fair, it went better than I thought it would. But once again, it didn't really, everyone is talking about a local lockdown, a national lockdown. And it seems daft not to do one now, knowing what we know when we didn't do one last time. And even if it's only for 2 weeks, a 2-week little lockdown. Last week of October, first week of November. National lockdown, and then when we come back, these are the rules if you want to keep it like it is for Christmas. So you have to wear masks everywhere. You pubs must stay shut. This is this is that, this is the other, and just do it. Don't waffle. Anyway, I'm not Boris. You're Boris. So a huge thanks to Boris Johnson for joining us whilst doing that meeting. Very, very, very clever. Toffs TV, also a big thank you already. DC number 9, Robert Brown, Gold Darlick Who, Carly, John Higginbottom, T-Bone Jr. He'll have gone ages ago because it's boring when you're a kid. PS4 Legend. Thank you very much for watching, if indeed you still are. And all being well, we will see you for the next one. I wonder if, what's he called? Keir Starmer will get a... See, they do my head in. Keir Starmer and Lisa Nandia as our MP. They go on and they go, this is wrong, the government, but yet they've agreed with everything the government have done. And then afterwards, when it doesn't work, they say, oh, that was wrong, what do you do that for? But then they never come up with anything that could change anything. So I've not heard what Keir Starmer would do if he was Prime Minister. And surely that's quite important, I would have thought. Maybe? I don't know. I just think it's a little bit important that the Leader of the Opposition tells us what he'd do. So, yeah. So thanks everyone for watching, and I will see you again soon. Normal service will be resumed. It'll get back to being a stupid channel again. Till then, I'll be seeing you.